Hello, this is Dr. Kim Jong-il. Today is the second time of occlusal plane adjustment. In part 1, we studied how the occlusal plane changes and how the occlusal plane changes according to various orthodontic devices. In this part, we will look at what appliances are needed when changing the occlusal plane. In general, the method of changing the occlusal plane is as follows. ZCW, or counterclockwise rotation. When the upper UOP rotates counterclockwise, when the mandibular occlusal plane rotates counterclockwise. The occlusal plane of the maxilla rotates clockwise. The mandibular occlusal plane rotates clockwise. When the upper UOP rotates counterclockwise, when the mandibular occlusal plane rotates counterclockwise. Let's take a look at rotating the POP counterclockwise and clockwise. Let's look at the relationship between the occlusal plane and malocclusion. Class 2 malocclusion shows steep POP, and Class 3 malocclusion shows flat POP. Deep bite shows steep UOP, open bite shows flat UOP. At this time, the treatment direction of each malocclusion should be the direction of Class 3 for Class 2 malocclusion. In other words, steep POP is to be changed to flat POP, and Class 3 is to be treated in the direction of Class 2. That is, flat POP becomes steep POP. Deep bite should be in the open bite direction, that is, flat UOP. And open bite should be steep UOP. First, let's look at steep UOP. Steep UOP is closely related to deep bite. How can we treat it? The treatment mechanisms to intrude the maxillary anterior teeth or extrude the maxillary molars would be good. In other words, it makes the UOP counterclockwise rotation or flattened. So, what kind of device, which extrudes the maxillary molar tooth, is there? A commonly used device is the cervical headgear. Cervical headgear is very effective in treating Class 2 malocclusion. In the case of Class 2 malocclusion and deep bite, the UOP rotates counterclockwise because the use of cervical headgear allows the maxillary posterior teeth to be extruded and moved backwards. Next is the anterior bite plate. The anterior bite plate is an appliance commonly used in deep bite cases and has the characteristic that the upper and lower posterior teeth are extruded as the mandibular anterior teeth come into contact with the maxillary appliance. At this time, when the maxillary posterior teeth are extruded, the UOP rotates counterclockwise. The following is Class 3 elastics. There are long Class 3 elastics that use rubber bands from the mandibular anterior teeth to maxillary first molar or posterior area. The force vector moves the maxillary posterior teeth extruded and forward. This rubber band has been widely used in Class 3 malocclusion. At this time, UOP and POP become flat. However, since flattened POP is a common etiological factor in Class 3 malocclusion, long Class 3 elastics are not desirable. There is a face mask for extruding the maxillary posterior teeth. It is an appliance used to move the entire maxillary bone forward in a growing Class 3 patient. If you use such an appliance, inevitably, the maxillary posterior tooth becomes slightly extruded and may cause mesial movement. Next is the intrusion of the maxillary anterior teeth. Intrusion archway is commonly used to intrude the maxillary anterior teeth. Intrusion archway is mainly used for deep bite cases. As a result, the maxillary posterior teeth are extruded and the maxillary anterior teeth are intruded. So, UOP has the effect of rotating counterclockwise. Next up is the J-hook hypal headgear. A hypal headgear with a J-hook can be used to intrude the overrupted maxillary anterior teeth. Next, you can use mini screws to intrude the maxillary anterior teeth. The intrusion of these maxillary anterior teeth induces counterclockwise rotation of the UOP. In addition, the maxillary anterior teeth can be intruded by the MEAW force vector. If the MEAW is inserted and no rubber band is applied, the maxillary anterior teeth can be intrusion and labioversion. Steep UOP is observed in the deep bite. Changing steep UOP into counterclockwise rotation during deep bite treatment is an effective treatment method. When the UOP is rotated counterclockwise, the maxillary posterior teeth are extruded and the maxillary anterior teeth can be intruded. The intrusion archway used at this time guides the extrusion of the maxillary posterior teeth and the intrusion of the maxillary anterior teeth. Next is the malocclusion showing steep LOP. Steep LOP is closely related to open bite and class 2 malocclusion. In what direction should the treatment go? The LOP must be rotated counterclockwise. Counterclockwise rotation means intrusion of the mandibular molars and extrusion of the mandibular anterior teeth. What kind of appliance can be used to intrude the mandibular posterior teeth? There is a posterior bite block. The posterior bite block is used to intrude the mandibular posterior teeth of open bite patients and to extrude the anterior teeth. At this time, the mandibular occlusal plane rotates counterclockwise. Here is the MEAW appliance. When using MEAW, the rotation point of the mandible moves between the canine and the premolar, and the mandibular molars moves to the intrusion and distal. This intrusion of the lower posterior teeth induces a counterclockwise rotation of the mandibular occlusal plane. Mini screws can be used to intrude the lower posterior teeth. At this time, the force vector of the mini screws may vary, depending on the location where they are placed, so you should carefully observe them. With mini screws, the mandibular posterior teeth are intruded, and the mandibular occlusal plane rotates counterclockwise. The mandibular anterior teeth can also be extruded. What would be the case? When using class 3 elastics, the mandibular incisors are extruded and can be linguversion. Deep LOP is said to be frequently observed in open bite and class 2 malocclusion. At this time, the mandibular occlusal plane must be rotated counterclockwise. The counterclockwise rotation method is the intrusion of the mandibular posterior teeth and the extrusion of the mandibular anterior teeth. Which appliance can achieve these two effects together? There is a posterior bite block. Therefore, if there is a tendency for class 2 open bite, posterior bite block can be used. Flat UOP is closely related to open bite. At this time, the maxillary anterior teeth need to be extruded, and the maxillary posterior teeth need to be intruded. This will require clockwise rotation. What are some of the appliances that intrude the maxillary posterior teeth? There is a hypalgia. Hypalgia is generally used to intrude the maxillary posterior teeth. In case of high-angle class 2, also in the case of class 2 malocclusion, it can be used to move the maxillary posterior teeth distal. So, with hypalgia, the UOP rotates clockwise. In the MEAW, the rotation point of the maxillary MEAW is between the first premolar and the second premolar. At this time, the maxillary posterior teeth become intrusion and move to distal. UOP can rotate clockwise by this kind of intrusion. The posterior bite block in the maxilla can be used as a device to intrude the maxillary posterior teeth. Posterior bite block is mainly used in open bite cases. Since the maxillary posterior teeth are intruded and the maxillary incisors become extruded, the UOP rotates clockwise. Sometimes, TPA can be used to intrude the maxillary posterior teeth. The etiologic factor of class 3 malocclusion is overruption of the maxillary posterior teeth. Therefore, TPA can be used to prevent overruption of maxillary posterior teeth in class 3 malocclusion. Mini screws can be used to intrude the maxillary posterior teeth. Mini screws should be placed both buccal and lingual to induce pure intrusion of the maxillary posterior teeth. Let's look at the extrusion of the maxillary anterior teeth. In the case of class 2 elastics, the maxillary anterior teeth may become extruded as the maxillary posterior teeth move backward. At this time, UOP may become steepen. Flat UOP is a feature of open bite. It is necessary to rotate the flat UOP in a clockwise direction, i.e., the intrusion of the maxillary posterior teeth and the extrusion of the maxillary anterior teeth. Next is flat LOP. Flat LOP is mainly seen in deep bite and class 3 malocclusion. How to treat it? The mandibular anterior teeth need to be intruded, and the mandibular molars need to be extruded in order to be rotated clockwise. In the case of flat LOP, there are various appliances that guide the LOP clockwise. For extrusion of maxillary molars, class 2 elastics, anterior bite plate, intrusion archoir, and so on. For intrusion of mandibular anterior teeth, intrusion, archoir, anterior bite plate, MEAW, class 2 elastics, mini screws, and so on. These appliances can be used according to the malocclusion of individual patients. Steep POP is closely related to class 2 malocclusion. At this time, you need to rotate the steep POP counterclockwise. What does this counterclockwise rotation mean? Induces intrusion of the mandibular molar, extrusion of the mandibular premolar. When the mandibular POP rotates counterclockwise, the mandible located posteriorly moves forward, and the condyle that was loaded is unloaded. What kind of appliance is good at this time? You can get it through MEAW. In MEAW, the mandibular molar moves to be intruded and distal, and the mandibular premolar becomes extruded. By putting various rubber bands here, it becomes easy to make steep POP flat. Flat POP is closely related to class 3 malocclusion. At this time, the POP needs to be rotated clockwise. The clockwise rotation is the extrusion of the mandibular molar, the intrusion of the mandibular premolar. The occlusal plane plays a very important role in the direction of treatment as well as diagnosis. Clinicians should always check whether treatment is being done in the right direction. From the time of diagnosis, it is advisable to select a device that considers occlusal plane adjustment. I have already lectured that steep POP in Class 2, flat POP in Class 2, steep UOP in deep bite, and flat UOP in open bite. What is your treatment strategy? Treatment direction leading to flat POP in Class 2 and steep POP in Class 3. Deep bite treatment is making steep UOP flat, and open bite treatment is making flat UOP steep. Also, what you should consider is the etiologic factors of malocclusion. Class 3 malocclusion consider as the overruption of the maxillary molar, and Class 2 malocclusion as overruption of the mandibular molar. By using a device that takes into account these etiologic factors, you will be able to achieve a desirable therapeutic effect. This patient has 9 degrees UOP, 9 degrees POP, and has protrusive lips, normal UOP and normal POP. This patient has protrusive lips and has 10 degrees of UOP and 15 degrees of POP, namely normal UOP and steep POP. This patient has protrusive lips, but has a UOP of 17 degrees and a POP of 22 degrees, steep UOP. We will need time to think about which direction to treat these different occlusal planes. When performing extraction and non-extraction treatment. Thank you for watching.